Welcome to APAC Media's Good Governance series. Today we turn our focus to northeastern region of the country with a special spotlight on Assam. The state has made notable progress in strengthening the public health system, particularly by expanding infrastructure and improving access to across all over the district. As Assam addresses unique challenges such as recent floods, difficult terrain, and region-specific diseases and other burdens, we speak to Indrani Laskar, ACS, previously Additional Secretary in the Department of Health and Family Welfare, recently joined as Additional Secretary at Sports Department of Assam government to understand the state's healthcare priorities and the road ahead. Welcome, Indrani ma'am. Welcome to APAC Media's Good Governance series.
Thank you so very much for giving me this opportunity to speak. It's almost a big task for me to speak on behalf of Assam, but I would say that whatever little experience that I had in health sector, which is also close to my heart, given its priority. So thank you so very much. And I will speak whatever I can as an insight I had received as a bureaucrat working in the department for nearly 3 years. And thanks so very much for APEC for bringing out the series. I'll try whatever little I can give from my insight to all the questions that may come out on this platform. And maybe I hope that I can give an holistic view, a bird's eye view of the health sector. I'll try whatever I can, if possible, in my very small way. I cannot say I know everything, but whatever little I know. Thank you so very much.
So we will start our discussion with a very general question, which everyone wants to know. That see, Assam has made visible progress in strengthening public healthcare infrastructure in recent years. So,
Yes.
what are the key priorities of Department of Health and Family Welfare has been in all these years, and especially in the primary and secondary healthcare in rural and flood-prone areas?
So far as Assam is concerned, yes, we do have challenges because Assam is quite different when it comes to the diseases the disease burden that we have firstly, and secondly, as you have mentioned, the challenges that we have because of the natural calamities like floods and all. Thirdly, we also have got some specific problems, which is for Assam itself. For example, we have got, most of the people out here, we have, for example, maternal and child. I'll talk about that.
Yeah.
Maternal and child, as we know that Assam has got one of the highest incidents, but now we are trying to bring it down, I will say. And the priority has always been the tea garden areas where maternal health is also taking a backstage. This also has got to do because of the two factors. Maybe these people, they are not getting the enough nutrition, and also because of the dietary habits. For example, they have, because of the dietary habits, then also we have got the remote areas also where women are not being, given the priority as it should be. For them to take care of their health and all. So maternal health is also one of the priority areas, and together with it also, when we talk about the mother, it also happen. We also talk about the child, because a healthy mother means a healthy child. So these are the two factors. Assam has been taken care of. Then also sickle cell anemia, which is, it all happens particularly among the tribal population, as we know. And Assam has a sizable population of tribal population. So that is also one focus areas. Then we are also giving focus areas on, what you call it, the TB Mukt. That is also one of the focus areas. And last not the least, also developing the infrastructure, because, infrastructure, which means in terms of building up hospitals which have all the facilities, and also like not only the facilities, the standards are being maintained. For example, it has to be for the public health standard, that is the whatever is there, that has to be met. So overall, like we had been trying it, and of course when you're talking about the floods, we have a disaster management plan in place where we
Mm-hmm.
take care of the people who are affected by floods and all. Of course, that is seasonal, but then of course then there is the rippling effects, like after the floods, people have few diseases and all, which we are aware of. And then
Mm-hmm.
we have also certain, like for example, there is the flu is also out here because
Yes.
people here, yeah. So this is also one disease that has been coming up. We have got encephalitis, also malaria, also
Mm-hmm.
especially in the border areas, because these are because this also has got to do with the humidity and the climate conditions of Assam.
Mm-hmm.
So our problems can be based in classified into two.
Mm-hmm.
Some problems which are common to all India, and some are which are specific to Assam, just because
Mm-hmm.
of two reasons: because of what you call it, habits, dietary, demographic pattern, and so on and so forth. And these are
Okay.
all taken into account when we develop the roadmap for developing of the health sector.
Right, right. Okay, since you have already spoken about the maternal and child health issues over there, so I just want to know whether there are any particular, targeted interventions in Assam government which they have implemented, your department, your previous department has implemented to further reduce the maternal mortality and infant mortality and malnutrition in the state.
Yes, there has been, as has been told, because what happens is that first and foremost you will have to monitor. Okay,
Hmm. Mm-hmm.
for any scheme to be developed, we have to monitor. So there has
Yeah.
been the constant monitoring, the monitoring which is done not only
Hmm.
through the field level functionaries who are out there, and also because of from the department itself, we take care, we take
Hmm.
regular meetings, we make sure we put pressure so that people are on time, that the field functionaries, the
Okay.
ANMs and all, they are there on time. And
Hmm.
also we had been taking care of the facilities in the hospital. Okay,
Mm-hmm.
so that the new mother who comes is gets all the facilities, especially the new FRUs has been developed.
Okay.
And also the maternal, we also see that the
Hmm.
labor rooms are being
Mhm.
well equipped, and they have got all the facilities. So there are the two things: first and foremost, a woman who is expecting, a woman
Mhm.
who comes to the hospital for the
Mhm.
facilities when the child is being born, and also the also after she has given birth, we also take
Mhm.
care of that she is in good and proper health, that all the immunizations of the children and all are taken care of. So at three phases we are taking care of the mother and the child.
So we are discussing about your previous organization, the health department. So in terms of health, we have seen in all over the India the digital intervention of healthcare
Yes.
system has taken a big note in past
Okay.
few years. So, how is Assam leveraging digital health initiatives? I mean, such as telemedicine and electronic health records and health management information systems to improve access and service delivery to the remote areas of the state?
Okay, when you talk about the health sector, first and foremost, let us talk about the e-services that we offer,
Yeah.
first and
Yes.
foremost.
Yes. Yes.
So what we do is that let us talk about the birth certificates, the death
Hmm.
certificates, which is
Hmm.
also very
Yes.
important document. That is
Hmm.
totally, people get it because that is completely through digital intervention. We provide that e-service to it.
Hmm.
Secondly, is that what we one important when you talk about good governance. Okay,
Hmm.
one thing is that I would like to say is that Assam is one of the few states which
Hmm.
had recently launched the Madlipar, okay, for the
Hmm.
medico legal cases,
Yes.
because this is also one aspect, like there was not much it seems to be very far fetched, but then at
Hmm.
times there are not much of coordination between the police and the medical people during
Hmm.
of this Madlipar of this medico legal cases. So Madlipar has been in place, and it was recently, after lots of work, we had been able to put that in place. So this
Hmm.
is one of the big success of Assam. And of course,
Hmm.
digital, when it comes to digital one, we have got
Hmm.
the Digital India in place, which is been
Hmm.
implemented by we have got the NHM, which is taking care of it, and things are in progress. Like you cannot, you can say that Assam is not like the bigger states and all. Okay, we have got lots of challenges, but then yes, we are trying to, many things are on anvil, which we are trying to implement it.
Okay. Okay. So public health system, we know that public health system needs manpower. And
Yes.
when we talk about manpower, it means doctor, nurses, and other specialists around. So,
Okay.
what steps, the department was taking when you were there to address the human resource gaps and ensure equitability and equitable deployment of healthcare professionals across the districts? Because we need more doctors, more specialists, more nurses to understand what kind of issues are going on and serve each and every citizen of the state. So, what are your experiences over there?
See, for example, what this is a very pertinent question because
Hmm.
we are always like in rest of India. Also, we are facing the shortage of doctors,
Yes,
which we
yes.
believe will be covered up because new medical colleges are coming up, and probably
Mhm,
in the after two few years down the lane, that shortage will
mhm,
be covered up. But then saying that we cannot just sit tight and say, oh, we are having the shortage of doctors. We cannot give the doctors because people are there expecting that there will be doctors. And to meet
mhm,
that, first and foremost, the NHM is filling up the gap. They are
mhm,
providing the
mhm.
doctors.
Okay.
Secondly, since I was in the department, I was looking after establishment.
Hmm.
We made sure that when doctors are being placed, first and foremost, I'll tell you, during my
Hmm.
time tenure,
Hmm.
what we did
Hmm.
was that we had a huge recruitment of doctors being taken, which took place. Okay.
Okay.
And what
Okay.
we did was that it was in, I think, in the March or October, September, in that phase. Okay. And then
Okay.
second is that it is not just having the new doctors, it is also, secondly, a question of placing those doctors in
Hmm.
places where people need it. In a
Okay.
city like Guwahati, you
Yes.
don't exactly require a doctor. There are
Hmm.
so many doctors out there. And in fact, many
Hmm.
doctors prefer to be in the urban areas. So we
Okay.
made a list. First and
Mm-hmm.
foremost, we made a list. First and foremost,
Hmm.
the tea garden areas, because tea garden areas, as I said, they have got specific health problems, especially maternal and health problems. Then maybe the
Hmm.
hill districts, they are far-flung districts. Then thirdly,
Hmm.
also there might be riverine areas also there. So what we did is that we got the report from the districts, because they are the base people who will be knowing where the
Hmm.
doctors are. So we got a
Hmm.
report from the districts, and then we made sure that these
Hmm.
doctors, at least, if not, say for example, 5 doctors are required, at least we make sure that in that place, at least there are 2 doctors out there, at least giving the basic requirement is being made. And
Okay.
also we made sure the specialists are also there. The specialist, if I put a specialist in a small sub center, it will be of no use. He should be there
Hmm.
in the district hospitals, where he can give his services, his specialist
Yeah.
services. So that way we tried to bring about rationalization of the posting of the doctors.
Hmm.
So, and that is it. And nurses also, that way, like we made sure that they are evenly distributed across.
Hmm.
And we
Hmm.
also made some, because when you work, you also
Hmm.
need some incentives. Okay.
Hmm.
So
Hmm.
during my time, like we tried to give the incentives so far as
Hmm.
that they get the, facilities to study and all, that also
Hmm.
we give some rules and regulations, so that, they come back, they feel encouraged to go on studies. We highlighted that these are the subjects which they can take over, and they go for the PG and all. And not only that, one good thing is that when we talk of doctors, it is not just the allopathic doctor. We also need to talk about the Ayush doctors. Okay,
Yeah.
so they
Yeah.
are also, we know that it's a part of the government policy also, that they will help the allopathic doctors. These also
Hmm.
we had done. We had got many Ayush doctors recruited. We trained them adequately. And
Mm-hmm.
also we had got the service rules in place, because once they have, was a long standing problem they had. Yeah, unless and until a person has service rules, he will feel motivated, encouraged, and it will also ensure more disciplined way. So whenever we had talked about doctors placing it is not just placing a guy, out here just because it is being needed. You have to have the perspective of the whole of the health sector, what needs to
Yeah.
be done, and then placing it adequately so that we meet the SDG goal of
Mm-hmm.
effective, affordable, reachable healthcare
Yes.
to all.
Right, right. So
Yeah.
we have discussed almost everything, but I specifically want to address one thing. Um, During a discussions a few months ago with a very senior official from the Ministry of MDonor, so I was told that cancer has been a very highlighted issue and a major health problem in all over Northeast, if not only specific to Assam. So, is it is it a really big problem in Assam also? And if it is, then what are the reasons and what the ministries, what the department has been doing so far to address those kind of issues?
I'm so happy and that you have raised this question, because this is one cause which is close to me, not just because I happen to be in health department, but because this is a social cause I am also involved with. Assam has got the highest incident of cancer, especially the throat cancer, and that also because we know that in Assam we have this habit of chewing betel nut. Okay, so
Okay.
now the focus is in on first and foremost awareness, and secondly is prevention. In fact, me as not only being in the health department, but also because of my own personnel, because I'm very committed to that prevention of cancer and all, along with Biburo Cancer Institute. You must have heard about it. So
Yes.
we did
Yes.
some campaigning in some areas, like we went to Morigaon, we went to Darang district, we went to Kamrup, okay, and then we tried to raise awareness, because
Okay.
what happens is that most of the people, for example, you are not being able, when we are talking about the throat cancer, a person is not being able to swallow or something like that, and then what happens is that he thinks that he's having tonsillitis or something like that, and at the third stage or the fourth stage the person comes. Okay, so what happens is, this is where we have to know the symptoms. Okay,
Okay.
and we have to talk about it. And in fact, when I was in the health department, I also conducted two camps in the secretariat, Assam secretariat, because
Okay.
we talk about the public, but what about the government people? Okay, we have got 4,000 people who are working in the Assam secretariat, and it was very encouraging to see that people, our employees, our officers, has come and gone through, and we women also have got breast cancer, cervical cancer. This is also two things. So being a
Yeah.
woman, I also took interest that these two, breast for screening for breast cancer and cervical cancer is been taken care of. So these is what we had done, is when I was in health, as a part of this cancer incident is concerned. And of course, like you all know that about how focus is also being given by the government as a whole, by setting up cancer hospitals across Assam. And in fact, I was previously also done another stint in health department, and it was only because of the vision of our honorable chief minister, Shri Himanta Biswa Sarma, that we had been able to get the cancer hospitals across Assam with the help of Tata Memorial. That was one big achievement for the state of Assam. And
Right.
I think, even if I'm not in health department, I'll continue to work for this cancer awareness and prevention of cancer. We have done commendable. I mean, our doctors have been doing commendable job in this.
That sounds great. That sounds great. Thank you for your contribution to address this kind of issue, which is very, very serious. And
Yes,
it is very, cancer is something which you cannot eliminate just in 2 days. It is awareness and health understanding of the disease and how to prevent it and how to proceed with it.
exactly.
So it is a wholesome thing. Lastly, I want to ask you from something about your current department. So, since you have just started the sports department as a additional secretary, you joined, I believe you have some kind of ideas how you're going to proceed with this department. And sports, specifically football and other sports which are very famous in northeastern side, from Bengal to northeast, the entire region is very well known for its uh, fans basically. So what are your thoughts and how you are going to proceed with this new department? What is your plans for this 2026?
Okay, as of now, I've joined the department. Okay, and as you
Mm.
have rightly said, that in sports we are very good with contact games like
Yeah.
boxing, martial
Yeah.
arts, and all. I myself had been a player once, so I know
Oh,
at one time Assam was doing extremely well in few
yes.
games. Like we were extremely good in swimming, we were
Mm.
extremely good in table tennis, and I used to
Mm.
play table tennis, and my
Oh.
family was associated with lawn tennis. And so,
Mm-hmm.
Assam do have, why I'm saying is this, Assam does have a great pool of talent. So far as sports is
Mm.
concerned, we have a sports
Mm-hmm.
policy in place, not
Mm.
exactly like in Haryana and OL, where I had got the first hand experience of seeing
Mm-hmm.
how the sports is a part of the culture, and it is imbibed in the society, that your prestige is with
Yeah.
the sports, that has to come into Assam, in Assam, because it is not
Mm.
just, first and foremost, what I feel is that when it comes to sports, we talk
Mm.
about the, you go and get medals. That shouldn't be my personal view is that we shouldn't talk about go and get the medals. We should tell
Yeah.
each of the performing athlete that you perform your best. Okay,
Mm.
and what I feel is that rather than, other than the training and all, the psychological effect of the
Mm.
sports person, he goes to a big stadium, he sees lots
Mm.
of people. Most of the sports person, being a sports person myself, I could feel it. You become sometimes very nervous, you are not able to
Mm.
put in phone. And also
Yeah.
when nutrition is concerned, we have to take
Mm.
care of that also. So
Mm-hmm.
and also we have to talk about the technicalities. For example,
Mm.
when you play, I'm talking from the sports that I had played. For example, if you play tennis, you will
Mm.
have to know exactly how your the other opponent is been serving, and what exactly, how
Mm.
you will going to counter that. These are the
Mm.
actually not just, going out and playing and all. These are the factors also which needs to be taken care of. And I'm sure our chief ministers, who is always very dynamic, and he's also been associated with badminton, his wife is associated with lawn tennis. I'm sure that Assam will progress in the long run, and especially focus is, and so many new events are been coming up. We have
Mm.
this cricket also,
Mm.
which focus has been there. So I
Mm.
feel that Assam will become a powerhouse, sports powerhouse in few years to come. We are optimistic about it.
Yeah, even we are hopeful about it that we are going to see
Yeah.
more and more sports personalities coming out of the northeastern region and specifically Assam, of course, because we
Yes.
have seen many great names. There are many great names from the northeastern sides. So thank you,
Yes.
Indrani
Thank you.
ma'am. Thank you for
Yes.
this
Thank you
discussion. This
so
is
very
wonderful
much.
discussion we had, and we are looking forward to seeing Assam grow
Yes.
and shine as usual. Thank you so much.
Thank you so very much for this opportunity. I'm really grateful for this.
Thank
Thank
you.
you so very much.
Thank
And
you.
all the
Thank you.
best for your future events. Thank you so very
Thank
much.
you. Thank you.